So today's subject matter is really an examination of epidemics and how we think about really and discuss the beginning and ending of epidemics. What we know is that these ideas don't really usually map on very easily to our senses and our own experiences, as many of us are sort of living through COVID. But actually some of these questions around the ethics, who should decide when something has ended, what does an end look like, and what are the ethical issues that's generated by official declarations of an end, is something that I'm personally very interested in. I am Patricia Kingori. I'm Professor of Global Health Ethics and Sociology at the Ethox Centre in Oxford. And together with 8 collaborators, I'm fortunate enough to be the recipient of a Wellcome Discovery Award, which is starting at the end of this year. And the question that we're really asking is what happens after the end? So what happens after the end of these official declarations, and how do people live and make a life in terms of living with these sorts of endings? So without any further ado, I would really like to hand over to our 3 speakers today. We've got Professor Calvin Ho, we've got Professor Rupeng Lee and Professor Suri Moon. Calvin, I believe you're the first person, so would you like to start by introducing yourself, and then we'll go straight into your presentation. We'll do all the presentations back to back, and then the second half of the discussion will be all of the questions, and we'll go through those. Thank you for those who sent through your questions in advance. We'll try to get to all of the questions, but we've got quite a large number of participants who joined today. So thank you very much, and I'm really excited. Thank you, Calvin.
Thanks so much, Patricia. Hello, everyone. My name is Calvin Ho, zooming in from Hong Kong for Chinese speakers. 新年快乐. So we're going to get started. Let me just share my screen. Okay. I hope that's coming through. So as I've got 5 minutes, I'm going to be very quick on the number of my slides because I tend to have too much materials, I'm afraid. So very helpful set of questions that we've been given. I believe this has been shared with everyone. So I'll attempt to speak to all of them, starting with the second one, because that's more of a descriptive kind of question, whereas the other 3 are normative in nature. So when we think about motivations and implications, starting with motivations, I think it's clear to all of us that in terms of the approach that's been adopted by the WHO, it's very much focused on scientific risk evaluation of public health, of course, risk pertaining to the evaluation process. So an example will be the likelihood of a more dangerous variant of COVID arising. So that is one of the considerations taken on by the emergency committee, as we shall see in a bit. And of course, in thinking more broadly about motivations as well, general concern would be to secure health system capability. Of course, generally, countries around the world want to ensure that their health system is not overwhelmed by the pandemic, and there is a broad agreement that in terms of the measures that we have in place, they should be directed at protecting vulnerable populations. So what are the implications of such declarations as the public health emergency of international concern? I'll speak more about that in my next slide. But when we think about declarations such as this one, it attempts to scale up on public health surveillance, as well as the introduction or scaling up, for that matter, of public health countermeasures directed against the pandemic. There will be border controls. All these measures we should already be very familiar with. And then, of course, resource allocation. So with COVID, these are just some examples. Again, I don't think I need to elaborate on that because I think all of us in the audience will be very familiar with these occurrences. So I thought, going to the normative questions, in thinking about the ethics around declarations of epidemic or pandemic, let me speak to pandemic because it's most pertinent to the context that we're still in right now. So you know that as far as the public health emergency of international concern, is about, this particular declaration arises from the International Health Regulations, the most recent version being 2005. And you see, it speaks to, and the definition here is really helpful, an extraordinary event which constitutes a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. So this speaks to the purpose of the declaration being made. And under the international health regulations, which is of course an international treaty, it creates an obligation on WHO member states to conduct surveillance and report unexpected or unusual public health events. What I'd like to highlight here is that as far as the 2005 version of the IHR is concerned, it's no longer limited to defined diseases, but it's a lot more open-ended. Although that said, there's still a list of notifiable diseases, which of course must be reported up to WHO by member states should the occurrence be discovered. So in terms of the background, which may be helpful when we think about the ethics, as far as the IHR is concerned, as I've mentioned, it has taken a more open-ended approach now. Of course, these changes came about with SARS in 2003. You'd find that this shift is important because there is a lot more emphasis on risk assessment now, whereas it used to be more event-based. And what you have also would be a shift from a passive reporting system to something that's a lot more active, and you've got WHO taking on a more active role as well in terms of the surveillance kind of function that has taken on. So in terms of how this declaration comes about, the Director General essentially will consult if he does not otherwise secure agreement from a member state concerned. He will consult with an emergency committee, and the emergency committee takes into account essentially scientific evidence. And of course, this evidence relates to the assessment of risk to human health. But what's important to note here is that there is no mention in this particular process of economic, social, cultural, and political impact of the determination of a public health emergency of international concern. So this particular declaration is essentially premised on science. And as you see, I find that to be problematic when we think about some of the ethical impact or ethical issues that might surface. But essentially what we find here is that for this particular mechanism that's linked to this declaration, it is essentially an alert system. And as we move forward, we might want to think about whether this system should do more than just merely signal or provide a signal and an alert. And for that matter, the signal itself tends to be quite flat, and I'll elaborate on that in a bit. So whether it should be diversified in terms of thinking about the sort of risk that we are grappling with as an international committee is one of the subject matter that we might want to engage with moving forward. So when we take on the ethical considerations, let me share three of them. Of course, there are a lot more ethical considerations that we could take on, but when we think about global justice concern, so global justice here speaks to just distribution of benefits and burdens across the world, as well as the viability of the institutions required to secure such a just distribution. Now, as I've mentioned, if the declaration of the public health emergency of international concern is essentially a technical assessment and is premised only on science, then the problem here is that you only have a very limited conception of the sort of challenge that would come with this particular declaration. And this particular challenge is compounded by the fact that as far as WHO is concerned, this particular mechanism is not clearly linked to some of the other UN agencies that may be looking into pandemic concerns. And of course, then this creates a rather difficult situation of understanding holistically the sort of vulnerabilities that we're dealing with, and where we also are to address the challenges that are faced by the worst off in any society. Again, if we are to just look at only the technical dimension without grappling with some of these other aspects, it forms a very limited worldview, and therefore it also limits the sort of approach that could be adopted. There are some promising developments from this pandemic, our experience with COVID. So as many of us would know, WHO is now working actively with the World Trade Organization and the World Intellectual Property Organization to improve access to vaccines. But beyond this point, there's a lot of ambiguity as to what's going to happen. So will such an arrangement continue? Will it apply to future pandemics? And will it extend to other forms of interventions, say therapeutics or for that matter, diagnostics? So these are some of the issues that I think reflect the sort of limited approach that is currently adopted in terms of how we understand the risks that a pandemic gives rise to and the sort of challenges that we can mount. There is also the problem of proportionality. So by proportionality, it speaks to the moral principle that an action should be no more severe than what is required. Within an international law context, it speaks more broadly to fair and optimum balancing of interests. Now, I think this principle is important because, as I've mentioned earlier on, the declaration, the PHEIC, Public Health Emergency of International Concern, is essentially just one standard. So that there isn't an indication of whether we're met with a very serious risk. It no doubt would be urgent, but how serious is it? And for that matter, how quickly must such response be mounted? And is this the case for each and every pandemic? You'd find that for the various pandemics for which such a declaration has been made, there's some variability there. So at this particular stage, if we are to give better effect to the principle of proportionality, perhaps we might want to think about moving beyond just a single standard and to think about something that's more gradated, especially when we are considering risk evaluation. And finally, in terms of the third ethical principle that we might want to consider, that of course will be solidarity. So while the current mechanism gives very strong effect to the Westphalian model of recognizing state sovereignty, we might want to think more moving forward about common interest as well as mutual support. So I think that there are a number of strategies that could be taken on, but the current approach of praising or shaming member states because they are not compliant or they're not sharing enough information, I don't think is a very helpful approach, particularly if we want to encourage participation and build trust. So, so final question in terms of who should decide. Well, my sense is that WHO should continue to have this particular role, but we need to think about moving the mechanism that we currently have beyond technical evaluation. So an example, of course, would be how the Zika pandemic declaration was terminated. Of course, that was concluded, again, essentially based on technical evaluation. But you find that even with the cancellation of that particular declaration, there would be continuing concerns and continuing need to monitor the progression of this particular disease. So the problem or the challenge is not quite over, but the problem is that with the termination or the cancellation of this particular declaration, it seems to give people a sense that the problem is no longer there, which is of course far from true. So that's something that we might also want to grapple with moving forward. So should one country be able to declare a pandemic to be over? Well, of course, under the Westphalian model, countries are free to do that. There is nothing in international law to compel them otherwise. But that said, pandemic, as we all know, is a shared concern, and looking at the diseases that we had to deal with in the past, would find that there will be a need for long-term and often intense public health measures to be taken on and taken forward. So this, again, in terms of our current arrangement, does not speak to the need for continuing collaboration and the need to engage with these in a way that, of course, speak to a number of justice and capacity related kind of concerns. So that's what I have. Thank you very much. I hope I've kept to the 5 minutes, but very happy to take questions later on. Over to you, Patricia. Thank you.
Thank you. That was such a great start to these discussions. And I'm sure I can really see some questions, but I'm sure participants will have lots of questions for you at the end as well. Really fascinating. Thank you very much for taking us through that. So I think next on the list is Professor Rupeng. I'm just going to hand over to you to introduce yourself and your talk.
Yeah, thank you, Patricia. I'm Rupeng Lei. I'm from Huazhong University of Science and Technology. Huazhong in Chinese means Central China. And we established a Center for Bioethics since 2002, and host center for bioethics. And we are located in Wuhan. And it's a great pleasure for me to be invited to participate in this epidemic ethics webinar series. And this is a second time for me to participate in this. I think it's a great event. But today, due to the time limits, I only have 5 minutes. So I'm going to focus on the issues in determining the ending of epidemic. The end of epidemic does not mean the eradication of the disease. The eradication of smallpox is an exception. Typically, the end means a disease become endemic, such as malaria, HIV/AIDS, etc. It is unlikely that COVID would be eradicated. The highly probable is that it would become endemic. So next, I will focus on ethical considerations related to this declaration of ending of epidemics. This is ethical considerations are very important, and epidemics are as much social, cultural, economic, and political phenomena as they are biological ones. So social, cultural, and political factors will play a key role in driving and defining the end of this epidemic. So even as a virus keeps circulating and recirculating. So I would like to make 3 points regarding ethical considerations in the determination of an epidemic ending. First, in determining whether an epidemic has ended, we should be based on the result of comparative assessment of the ratio of risks benefits caused by 2 options. One is the ending of an epidemic, and the other is still keeping harsh restrictions. So it's a kind of trade-off between risk and the benefits of these 2 options. So the assessment should be comprehensive, not just a technical assessment. For example, we have to consider not only scientific dimension, biomedical and epidemiological, but also social, economic, political, culture, and people's daily life dimension. The ending of an epidemic be determined on the basis of the assessment that the option of the ending would bring about less risks than the other option of sustaining restrictions. So COVID would end with becoming endemic. And endemic disease doesn't necessarily mean a disease is rare or common, mild or severe. For example, infection rates can still be high, such as malaria, but they are static and predictable. The virus keeps circulating and recirculating, but is no longer causing major peaks in severe illness or death. The prevalence would be at acceptable level. So people have to learn to live with the virus. People would be back to normal life. In that case, the government, society, and people have to prepare well to coping with risks after the ending, so as to slow the virus transmission, prevent infection, and reduce severe cases and deaths after the ending of the epidemic. So try to summarize. This is firstly, this is a important trade-off between risks and the benefits, especially the whole risks, biological, medical, and epidemiological risks, and also social risks in a comprehensive approach. And second, select a proper time to declare the ending. So it's a premature, early, and late declarations will raise problems. And third, while preparing for coping with risks after declaring the ending. So that's first ethical considerations I'd like to make this point. And the second point regarding ethical considerations, this is a respect people's rights to be involved in decision making of whether the epidemic ends and how to declare the ending. So it is people, not the data, to say whether the epidemic has ended. So people's belief and attitude matters. So this is the attitudes we have towards such, figures and numbers and data. For example, numbers of cases or deaths is as important as the numbers of themselves. So people may grow so tired of the restrictions, especially long-term restrictions, that they are willing to declare the epidemic over, even as the virus continue to circulate in the population and before a vaccine or effective treatment is found. So as people, move through different stages of the pandemic, as they endures long-term restrictions and frequent tests, they adjust their understanding of this data and numbers and gradually live with the virus and accept it as a simple fact of life. So there is also a cultural factor which we must consider. In Chinese history of 2,000 years, there are several epidemics, plague in each dynasty. On the basis of history experiences, Chinese believe that 大疫不过3年. So it means, the big epidemics, the plague lasts no more 3 years. So Chinese would not accept restrictive policy more than 3 years. So there were more and more complaints and conflicts among general public, especially at the end of 2022. This is the second ethical considerations. And next, I'd like to talk about this as the third one. Care for the vulnerable in the period of COVID becoming endemic. But Professor Hall just mentioned about, this is, I think, the similar considerations, but this is how to define the vulnerable group. But I think that is the important, when we think about this declaration of the ending of this epidemic ending. So this is care for the vulnerable group and community. So it is uncertain about how the virus will mutate. So in the case that the virus become more virulent, we should protect the vulnerable, such as elderly, children, patients in hospitals, persons in poverty and marginalized, vulnerable communities in a possible new wave of cyclic outbreaks. I'll shift to the second questions. Who determines that an epidemic has ended? I also I read an essay written by two scholars from Oxford, published August 4, 2021. The title is "The End of the COVID-19 Pandemic." In this essay, these two scholars, make the points, this is considering the nature of ending an epidemic can also help us consider, who is involved in these decisions. If the end requires societal, cultural, and political agreement on what is a locally acceptable level of disease or what does a new normal life look like, the discussions should include input from those who specialize in understanding society, culture, and politics. Such discussions must involve experts beyond the fields of medicine. So there's ethicists, philosophers, and historians, as well as anthropologists, sociologists, economists, and political scientists should be involved in this kind of discussion. And also such discussion will necessarily involve articulating social priorities and cultural values and calculating risks and benefits. So if all necessary precautionary measures are in place, the people of a country can determine the ending of COVID epidemic. Nonetheless, they have to prepare the worst. In the worst condition, they can determine to declare the revival of the epidemic. So this is the end of the epidemics depends on how a society decides to respond to a pathogen that keeps circulating. So the end is a process of negotiation, and its dynamics are often unclear and not explicit. So it's a kind of, just I mentioned trade-off, this kind of trade-off. That's the trade-off between the whole risks and benefits, health, economy, society, and so on. This is in comprehensive way, not just a technical assessment. And also, I think this kind of the decision and declaration of the epidemics ending also a process of trial and error. So yeah, thank you very much.
Thank you. That's so great. Thank you so much, Professor Lee. Yeah, so now our next speaker, Professor Moon. It'd be great if you could introduce yourself and then we have your presentation just for questions. Thanks.
Thank you so much, Professor Kingori, and thanks to the organizers also for the invitation and the opportunity to be here with all of you. As somebody of Korean descent, let me also wish you a happy New Year, a happy Lunar New Year, and say 새해 복 많이 받으세요. I'm certainly not an expert on the ethics of the beginnings and endings of pandemics, but what I do is I study the global governance of epidemics and pandemics. And so I wanted to offer a few comments on a number of the governance questions that come up, which the previous two speakers have already touched on. But I'd like to focus in on this perhaps in a little bit more detail and offer you 5 points in 5 minutes. That will be my ambition. I want to begin by reminding us of the very practical consequences of the beginnings and endings, these sort of official declarations. And I think Professor Calvin Ho covered a lot of ground in his presentation. Let me add to that a number of private actors may also base some of their decisions on what they do based on what a government or an authority like WHO declares. So for example, AstraZeneca, which is the manufacturer, one of the major manufacturers of the COVID-19 vaccine, committed in the early days of the pandemic that they would not earn a profit on this vaccine for the duration of the pandemic. Which most people interpret it to mean until WHO declares an end to the public health emergency of international concern. And I flag this very concrete example because I think it's a reminder of the sometimes unexpected ways in which these decisions can have reverberations throughout the system. And this is a big question actually that we're wrestling with here in Geneva. So I should have mentioned in my introduction, I also co-direct the Global Health Center here at the Geneva Graduate Institute. And one of the processes we're following and working on quite closely is the negotiation of a pandemic treaty and the very closely associated process of amending the international health regulations. And I see my colleague, Gianluca Berci is also on this call. So I rely on his expertise in this area as well. And I flag these two processes because this very question, what is a pandemic? When does it begin? When does it end? Who should decide? Should there be, a different system of traffic lights, et cetera, is very much on the policy agenda here. But one of the ideas that I think we've perhaps not given enough attention to yet in this discussion is what are the different levels at which these declarations or decisions can be made and should be made. And I think one of the things we always have to remember about global governance is that it's a very thin layer of governance, and it sits on a much more robust layer of national and local governance. And I flag this because one of the key points I'd like to raise for your consideration is just because WHO makes a certain declaration, should that necessarily change how regionally or nationally or even locally authorities decide whether or not, let's say, a particular epidemic or health situation does deserve some kind of special consideration or special treatment. And I would argue that we need a multi-level consideration, that sometimes we may have truly the end of a global emergency or an international emergency, but very much still be in the middle of a national, local, or regional emergency. And I think we need to remember and consider how can these multiple levels of decision-making work better, and to not perhaps only be focusing on the global level decisions, which necessarily will not be appropriate for everyone at all times, as the former speakers highlighted. So the first thing is to think about the levels. I think the second factor I would urge us to consider is there's huge variation, of course, between pathogens, between types of outbreaks. If we think about pandemics, this concept of pandemics or epidemics, we can think about them as applying to an infectious pathogen like COVID, obviously, but also to an epidemic of gun violence in the United States, for example, or an epidemic of antimicrobial resistance. Some people have called this the silent pandemic. Malaria, Professor Lei mentioned, multi-drug resistant tuberculosis, all of which behave quite differently. Cholera, I understand if we have one case of cholera, this is grounds for declaring an epidemic or an emergency because it's so contagious and it's so dangerous that even detecting one case means you are in the middle of an epidemic. And so if we think about this variation, not only by country and region, but also by pathogen, I think it becomes quite clear that we do need, of course, data and science. But as my two colleagues have, I think, very, very strongly pointed out, science and data are not enough. But I do think that we cannot lose sight of the importance of having good science and data and transparency in that science and data. And to me, transparency is one of three important governance principles I think we should keep in mind. This brings me to the third point I wanted to flag. So what are some of the factors we should be keeping in mind when we think about decision making? In addition to transparency, I would say you want, of course, participation and inclusion. Those who are affected, those who would be, for example, negatively affected if an end to a pandemic were to be declared, but also those who might be positively affected, right? There are those who will be hurt and harmed or will benefit one way or the other. And I think the challenge for decision makers is, of course, to try to take into account and develop a full understanding of all of the implications of what their decision would be. And one of the best ways to do that is, of course, by ensuring widespread inclusive participation. The third governance principle I think is important to keep in mind is accountability. So we've talked about transparency, about participation and inclusion. And the third one I would say is accountability. And it's very difficult sometimes to think, especially at the global level, how do you keep a global decision maker accountable? If Tedros gets it wrong, is there a way that he can be held accountable? Not necessarily an easy thing, neither at global nor at national or local level. But I do think if we break down accountability and we think also about answerability and we think about reversibility, this may help us to find more practical answers. So if a decision maker says, I declare the end to this epidemic or pandemic, they should be answerable to critique, to question, to public debate and disagreement. And this decision should be reversible. We know, unfortunately, we've been through multiple waves of COVID now. We know that this can keep surprising us, as can many other kinds of pandemics. And how do we ensure that the systems we put in place for making these decisions ensure not only answerability to affected people, but also a reversibility? If that should be needed. I think I've covered most of my key points. There's a last one that I wanted to flag before wrapping up, and this is what happens practically. So I think in some cases, I flagged the AstraZeneca example. In some cases, an official declaration does trigger a whole series of other consequences. And it also sends an important political message. However, that need not be the case, right? It need not be that every measure, every support given to patients or to certain vulnerable groups, et cetera, those need not be linked always to declarations of epidemics and pandemics. So for example, we know that the mental health consequences of COVID-19 will be very, very long. We know that the impact on educational attainment by children will not really fully be understood for years. We should put in place measures that will support those children for years to come, regardless of whether there's an end to a pandemic or epidemic that is declared in the meantime. And so how can we think in a creative and proactive way about ensuring all of those supports for different groups in society are there, regardless of whether there is an official declaration made. And I think these are ways to think more holistically about the implications, but also how to manage some of the unintended harms, perhaps, of declaring an end to a crisis. Thanks very much.
Thank you so much. I mean, really three great speakers from different perspectives, but there are definitely some really useful overlaps. And yeah, I'd just like to start really by thanking you for that and really for opening this up. We've got a number of questions that have been sent through, but also some questions that have been sent before we actually had today's talks. And so I just wanted to just hear your views and open the discussion. So the questions are basically really far-reaching, but essentially there's a number of common ground between them, both the ones that were submitted before and also today, which really center on this idea of the usefulness of the definition or even the declaration. So a number of the questions are really centered on, is this even, what is the value of declaring the end, and is it actually helpful? So I'd like to just really start off maybe with you, Calvin, and ask you, Professor Ho, what's the point of all of this? What's the value of it? In even this idea of calling something an end?
Right. Yeah. Thanks so much for the question, Patricia. Thanking both speakers as well. Great points there. Wonderful learning experience for me as well. So the declaration itself, I think, is important. Just to pick up on what Suri has mentioned, of course, there is this need to get good science. And in order to get hold of good science, you need to have a process to essentially look at the data and to make sense of what's coming at us. So my struggle is that at this particular point, we just have a very limited alarm system that's in place. So it's just based on data that's been gathered in a particular manner. And there's not enough to help us think about the sort of challenges, the sort of vulnerabilities that might arise from a declaration of this nature. Of course, declaration is a formal term, but ultimately it is just a signal that we should be very worried that something is coming at us very quickly. The other struggle that I have is that it's very difficult to understand how communities, how governments make sense of this particular system. As we see with this particular pandemic, it's either ignored or you'd see massive overreaction. So what does it mean to get it right? And what exactly does it mean to put forward appropriate recommendations? Because ultimately with the declaration, WHO, the Director General in particular, would also put forward recommendations for governments. So when we think about a lot of vulnerability related issues that Professor Lei mentioned, and then of course the governance sort of issues that Suri has very helpfully pointed out, I find that it's very challenging to link up all these various parts. And when you have a piece that's just floating out there, there is a very high chance it will be misinterpreted by the various stakeholders, whether we're talking about governments or communities, and even worse, if you're hoping to galvanize global efforts. So I guess our experience with COVID just shows that a lot more needs to be done beyond this very basic mechanism that we have in place. Thank you. Over.
Professor Moon, would you like to respond?
Sure, yes, I absolutely agree. We need more effective alarm mechanisms. I think one thing that we haven't really touched on yet in this webinar, and I'm not sure to what extent this is familiar to the participants, is the distinction actually between what is currently in the IHR, which is the FIKE declaration, Calvin, that you described very, very nicely, and what happened during COVID-19, which is that the WHO declared this emergency in January of 2020, very, very early on. And one of the reasons why, so they declared it in January 2020, and for 2 months, Dr. Tedros was kind of exhorting countries to take more action, exhorting countries to take this more seriously, to put in place measures. And he was being pressured by many commentators to say, call it a pandemic, use the word pandemic. And I remember he actually refused. He said, no, we don't think it's a pandemic yet. And then middle of March 2020, he said, it's a pandemic. And it was on every major newspaper headline. And the reason I flag this is because there is no legal definition of pandemic, right? This word is not in the international health regulations. And this is one of the big challenges today, as we're trying to negotiate a treaty for pandemics. What is a pandemic, and when should one be declared? Who should declare it, let alone end it? I do think, and many people will say, when Tedros finally used the word pandemic, it did seem to wake up a higher level of panic. I mean, useful panic in terms of getting public leaders to respond, even if it didn't have any particular legal meaning or weight behind it. And I do think that kicking people out of complacency into action is absolutely essential. And yet clearly we still have a tremendous amount of work to do to figure out what is a more effective alert system that will persuade leaders to take difficult decisions when that's necessary. But of course, that state of emergency that we've been in, many of us for a long time now, does have to end at some point. So coming back to Professor Kingori's original question, what's the point of all this? And we know that, for example, in a number of countries, you have emergency legislation that allows for the suspension of certain rights, for example, certain human rights under emergency laws, under emergency circumstances. Of course, we want those to end. We don't want an indefinite suspension. That's not, I don't think that's good for the most vulnerable, for example. But all of these difficult issues that we've been discussing today, I think, are exactly what we need to keep in mind. Who, when, how transparent, who gets to participate, how do we reverse these decisions when needed, how do we justify them? But I think we're all indeed learning together on this question. That's certainly a very, very difficult one.
Professor Lee, I wanted to ask you about one of the points you raised, because actually one of the questions submitted really relates very nicely to that point. So one of the things you said, which I thought was really fascinating, was really thinking about the kind of cultural factors. And then you mentioned this idea about 3 years being really significant in your context, thinking about, when something is considered legitimate and when something ought to feel like it's ended. And so one of the questions asked is, okay, so how do we reconcile, and how should we reconcile all these different cultural factors if we're thinking about a pandemic, which is, of course, over multiple contexts? How should we go about taking seriously the local and the cultural issues when we recognize that this is happening in different locations? So how do we end this? This is a different thing. How do we end this if we're taking seriously the local?
Since we have since we have Chinese interpreters here, I will answer in English, as I just mentioned. About the declaration of the end of endemic or pandemic. There are different levels, national levels, international levels. So therefore, So what I just focused on the national level. So it's on the national level or in the one society, how are we going to make this decision within the national context? We have to consider those ethical questions. So Patricia's question is also focused on in China. In China, this kind of environment. So within our 2,000 years of history, and then this is the kind of summarize our 2,000 years of history. So this came with the human endemic or pandemic, well, as old as the human race. So in the very, very early days of human history, we experienced endemic or pandemic. So we use the traditional Chinese medicine to treat those diseases. So therefore, our experience was any big pandemic would not last more than 3 years. This is why, in the sense of the culture, the concept. So this is the widely held belief within the society. So whether it's a belief or it's an attitude, it is very important, as I just mentioned. When we make a decision, this kind of cultural, historical element is very, very important. It's not just a mere technical matter. So we cannot just base our decision on figures and data. And also the attitude towards the numbers and the data. So I talked about that based on the national perspective. So I only China as an example. We have contagious disease as the statutory law about disease. So we have different, we have 3 levels. 2020, we classed COVID-19 as B, class B disease. So although we classed it as class B, however, we treat this as class A. So in terms of our method or measures, we use it, treat it as a class A. So therefore, so we have implemented very, very, very strict measurement. So, but these kind of measures, these restrictions have lasted more than 3 years. That is a very, very long time. So we had the kind of wide kind of scaled kind of PCR tests nationwide. So now in China. So now if we now announce this decision or declaration, so this is also very important in the national level. I would like to reiterate the Chinese government has not declared the end of the COVID pandemic. So all those in December 2022, the government announced that some of the restrictions would be lifted gradually. So we have not really declared the end of the pandemic. So the State Council has just merely announced the relaxation of certain restrictions. So they have published some data, some figures. So they also announced that they would no longer carry out this day-to-day PCR test. So that is, and then on the 8th of January 2023, so we again class the COVID-19 as class B disease. So that is the current situation. So gradually, there will be more announcement at the national level. So they will have more kind of specific measures to be announced.
Thank you.
So we have not really returned to the complete normal life level. So that's my answer for the time being. Thank you very much.
Thank you. And I hope that the participants were able to access some of that using the translation button at the end, so you can translate it into English for people who couldn't. But I really thought that was fascinating, just your response in terms of actually there's been no official declaration of the end. So some of the things that Professor Moon and Professor Ho were saying actually haven't yet necessarily transpired. And what I thought was really interesting, and some of the things that's coming out in the discussion and the questions, is how do we deal with this tension that in fact we want to take seriously, we want to move beyond the numbers and the science and take seriously local and cultural interpretations of the end and involve communities, but that they're all, even within China, there might be very different ideas about what that looks like. And then to think about it internationally, how do we make these kinds of ethical decisions that can reconcile this tension between very understandable and historical reasons why people have different ideas of tolerance and acceptability and the end. Professor Ho, did you have a response to that?
Right. Yeah. Thank you so much, Professor Kingori. So great observation there. I think one of the challenges that have come up with this particular pandemic, I think as all of the speakers have alluded to, is that we are not listening well enough, we as in policymakers, and well, essentially people in authority, and also not perhaps communicating well enough. So, and it's a difficult matter because when we're confronted with something that's novel, how do we engage with it in a proportionate, well-reasoned, and ethically justified way? So as we've heard from Professor Lei when she mentioned a more conservative approach that has been applied because we simply didn't know about this new virus. And then, of course, the key challenge then is when exactly, going back to Professor Moon's point about transparency, when do we know it's the right time to scale it back down? So it so happened that within broadly the 3-year time frame that Professor Lei mentioned, you have people either having developed some form of immunity, or we have vaccines in place, thankfully, of some effectiveness, or some that are a lot more effective. So these happen to be quite coincidental, but I think the counterfactual is that what if in the next pandemic we haven't got these developments? What if it's likely to stretch beyond the 3 years? Then how do we make such decisions? How do we communicate the sort of decisions that ought to be made in that sort of setting? I'm not sure that within I stand to be corrected by Professor Moon, that my sense is that the current global health governance system that we have do not equip health systems, whether it's national governments or international organizations, to address these sort of issues, let alone NGOs, or for that matter, individuals and communities. So I guess that's where we're at. My 2 cents worth, and I'm very happy to hear the thoughts of the other speakers. Passing the
See what you did there, Professor Ho. I mean, the point of this is that there is actually, it's not really straightforward, right? I think that's the whole point of the webinar, that actually these are ethical issues that I think Professor Moon had alluded to have existed for many, many epidemics before, but COVID has really brought these to the fore, and we don't really have necessarily clear guidelines, ethical guidelines of how to think about this. But the webinar is the beginning of conversations that might take seriously some of these tensions. So Professor Moon, I don't know if you wanted to respond.
Thanks. I just wanted to flag one important distinction that this conversation has helped clarify for me, which is I think it actually is very useful to talk about emergencies as a distinct concept from epidemics and pandemics. And it's actually quite interesting that in the negotiations that led to the IHR that we're currently living under, they stuck with this term emergencies. And the WHO department that deals with this is called the Emergencies Program, not an epidemics pandemics program. And I flag this distinction because I think you can imagine, let's think about HIV, right? HIV remains a pandemic to this day. It's a disease that is occurring worldwide. It's continuing to spread, continuing to cause a high level of deaths and disability. And I mean, it's a pandemic, right? And yet we have put in place a number of arrangements at the international level and at national level to try to address and control and reduce the effects of this pandemic. And there was a moment in time when HIV was very much considered a global emergency. I would say that moment has passed. I think it's no longer on that list of global emergencies. And perhaps there's good reason for that in terms of, considerable efforts being put in place. I'm not saying it's enough. I mean, we never quite do enough against all of the diseases that we're wrestling with as societies. But I think there's something to be learned from distinguishing between when are we in emergency phase where exceptional measures or exceptional restrictions or exceptional arrangements are needed and justified, versus when do we have a problem that we have to deal with, but we've put measures in place. Those measures can and should be sustained. And that could be the case, certainly, for many pandemics or epidemics. And so perhaps, despite all of the critiques of the IHR, many of which I share, this distinction between an emergency and a pandemic is actually a useful and an important one that we can keep in mind. So that a pandemic can continue or an epidemic can continue, but an emergency phase may be over and allow a certain shift in public policies, agendas, et cetera.
Great, thank you. I think I'm just going to quickly look, some other questions have been added. Many of the questions are actually looking at what are some of the implications of these kinds of endings. So, and the sense that some of these things is not really taken seriously. So one question is asking, okay, so when these things end, how do we address things like vaccine inequity if these protections are no longer in place? So really taking seriously that the significance of these endings and these declarations in terms of access to resources as something that's really important. We've only got a couple of minutes left. I don't know if anybody particularly wants to respond to that. Professor Lee, did you have a response or?
对，我觉得 Patricia 提的这个问题非常的这个重要。
What Patricia just raised is very, very important, particularly the equitable vaccination. The international equitable distribution. So our system, it will be very unrealistic for this system to realize equitable access of vaccination. So we had to discuss this topic. This also concerned. So that also concerns the declaration of the end of a pandemic. Some of the scholars mentioned this topic at the international level. If you declare the end of the pandemic, for some countries, the pandemic, the endemic has not really ended. If this decision is made internationally, we have to consider some very pragmatic issues, such as WHO. The WTO, they have signed contracts or agreement with some pharmaceutical companies like AstraZeneca, such as maybe during the pandemic or before the end of the pandemic. They will sell the vaccination at a cost, and they will not make any profit. They have this kind of agreement. However, if you declare the end of the pandemic, where this have an impact on the price of the vaccination. So all these questions we need to discuss at the international level. However, this will make this topic more complicated. WHO, I think this is only an alert system. So it has certain standards. So when an endemic becomes a pandemic, they have their certain standards. However, so when the pandemic ends, you also have certain standards to apply to gauge whether a pandemic is end. So Professor Moon also mentioned that HIV and AIDS. so now there are lots of medicine available for AAs, and also the distribution accessibility is quite widely available globally. So we have a certain so when WHO declares the end of the COVID pandemic, can they actually learn from the model that actually applied to AIDS? So
I think that's a really good point, actually.
Yeah, I think we can learn something from the model built for the AIDS HIV pandemic.
Thank you. And I think we probably all agree that there's a lot to learn. And I really like the point that you made that all of these questions introduce new complexities. I think we probably all agree to that, and that there's, you know, we could probably spend another 5 hours just discussing just the beginning of the definition of the end and what constitutes that, let alone getting into all the ethics. But I'd really like to, with all the participants, to thank you for joining, and thank you very much to all the panelists. This has been really fascinating. And yeah, this is really great to open up this discussion. We knew we wouldn't be able to solve any of the ethical questions, but just to kind of map out what some of them are. So this has been fantastic. Thank you very much for joining.
Thanks so much, everyone.
Thank you.
Thank you. Happy New Spring.